Healthcare is more than medicine. It's about people, families, and moments that matter. When Mrs. Mora came to visit her husband during his heart procedure, no one expected she would need life-saving care herself.
George was having shortness of breath on a Saturday morning. I took him to Temecula Valley Hospital because we had read about what a good hospital it was for stroke and heart conditions. He went up to his room. I went down to get us some coffee at this coffee shop, and when I started to return and push the elevator button, the coffee cup fell out of my hand onto the floor. The next thing was I went up to the room and a fork dropped out of my hand.
She told me something wasn't right, so I did a quick neuro check and said, I think you're showing signs of a stroke and I wanted to call for help. I called Code Blue Visitor overhead, and that brought the ER doctors upstairs, and they took her down to the emergency room right away.
Dr. Jackson, a neurologist, came in, and within a short period of time, he realized I had had a stroke. His quickness of action is probably what really contributed to having a very mild stroke.
I went down to the emergency department to see what was going on, and that's where I saw Chanel, our stroke champion nurse, on the floor, who gave me a quick, efficient rundown of what the patient was experiencing in that moment, the stroke symptoms, and the important pieces of the puzzle that need to be told in order to make critical decisions in that time. Because of her amazing, quick, efficient sign out of what was happening, I was able to evaluate Karen very quickly, and we were able to make important decisions of giving her the medication called TNK, which is the Drano medication to try to help bust up a clot that was happening in the situation.
Our priority was addressing the blockage in as quickly and as safely as possible. This was to prevent worsening or even recurrent symptoms, and that required clear communication across every service involved. Any excessive delays could have resulted in debilitating outcomes, and when each team does their part with consistency and discipline, the patient benefits, and that's exactly what happened for Karen.
I've been caring for George through his pacemaker procedure and recovery. So when Karen became a patient as well, it really brings their story full circle for me. Caring for them both shows just how important coordinated care is across the entire hospital. As they continue their follow-up care, I'll be watching them recover side by side, seeing them together as a reminder of why we do what we do.
I felt like family there at the hospital. All the doctors seemed to coordinate together and took great care of us.
Karen's experience reflects what we strive for every day: seamless communication, rapid evaluation, and compassionate expertise working together.
When I was released from ICU and got up to my room, there was a wonderful woman who came in. She just had such good advice for me. Every day she was there multiple times.
When I met George during leadership rounds, he was telling me about his story. I knew we needed to coordinate our efforts and bring them closer. Doing the little things that keep people feeling safe, supported, and never alone is what we do at TVH.
The nurses and the staff and the doctors all took the time to make them feel welcomed, and they treated them like family, not just patients, and they really made us feel like they were valued and cared for.
What really stood out to me was how every department worked together to take care of my grandparents, and it made it feel like one family taking care of our family, and that's just kindness that you don't see everywhere.
The hospital staff didn't just say my grandparents, they showed me what caring looks like. While there at the hospital, I also got to pursue the volunteer foundation, where now I volunteer in the emergency department and get to work alongside the nurses and give back to the hospital and be surrounded by the caring community.
The nurses were very, very kind and helpful. Then the CEO of the hospital came and to see us, and he prayed over us, and I thought that was exceptional and very nice of him.
On the day the Moras needed us most, our people stood together, so love could stay together.
After all we've been through, I'm thankful that we're together, and the experience at Temecula Valley Hospital was quite an experience because our kids were going from ICU to see her to up to the 4th floor to see me, and it was an experience to be there, and I'm glad that it's behind us now and we're together. She's a good wife.